I'd like to just welcome everyone to our opioid crisis panel. Joining us today, to my left, Father Bob Stec. He's the pastor of St. Ambrose Church in Brunswick, which runs a greater than heroin outreach effort. In April, Father Bob has asked more than 300 religious leaders across the county to speak about the issue on the congregations on April 23rd. Sitting next to him, Valeria Harper. She is the new Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services. Congratulations.
Thank you.
She's been an Adams Board employee for the last 30 years, and in this new role, she's responsible for overseeing 444 treatment beds for men and women throughout the county. Next to her is Common Pleas Judge David Matia. He helped create the Cuyahoga County's first drug court program in 2008. A member of the U.S. Attorney's Heroin and Opioid Task Force, he addressed members of the U.S. Congress in Washington about the epidemic earlier this year. And last but not least, Chief Cel Rivera. He served as the police chief in Lorraine for the last 24 years. 2012, as the heroin epidemic was just beginning to ravage Northeast Ohio, he helped lead the effort to get Narcan in the hands of police. In 2015, the state honored him for those efforts with the Ohio Distinguished Law Enforcement Training Award. Thank you all for being here.
Thank you, good to be with you.
So my first experience with heroin in Northeast Ohio was back when we were doing our Rating the Suburbs questionnaires. And in 2012, the city of Independence put their biggest concern as heroin. And I didn't believe it. It's not the place that you'd expect it, but here we are 5 years later, and we know that's certainly not the case. I'd just like to know from all of you what we've learned in the last 5 years and what the heroin epidemic looks like to you on the ground here in 2017. What about?
I can tell you a simple story. So I'm in Brunswick, Ohio, middle-class America, and part of what we've been doing through the Greater Than Heroin outreach is trying to stir up regional conversations. So back in February, we had a room filled with, in this case, Medina County leaders, 45 of them. Long story short, 3 of my members in the ages of 68 to 72 were walking past. They were volunteering in the other building. They're painting a room together, right? So they're walking past. They said, come in and have some lunch. They had no idea what they were coming into other than just to get lunch. They sat down. Long story short, everybody's going around introducing themselves. The first guy stands up and says, my name's Dave. I had no idea why I'm here, but now that I understood this, my grandson's an addict. The next guy stands up. My name's Steve. I was painting the other room. I came in for lunch, no idea. My son-in-law's an addict. Give me a heart attack. The third guy stands up. I had no idea. The third guy stands up and says, my name's Bubba, whatever it is. And long story short, my grandson's best friend died 2 weeks ago of an overdose. What does that say about his grandson, right? That story for me, among others, paints the picture of how deep this epidemic is gripping our region. And I think if there's anything we have or have not learned is I don't think we yet grasp the depth and the breadth of how close this is to every single one of us, and how it's going to take every single one of us to wrap our minds around this to walk forward.
Well, I echo and welcome the scenarios and having very similar circumstances and situations as we, the Chief William Dennehan, who is the chief of the Alcohol and Drug Addiction Board for another 3 days. He reminded me this morning my official position is effective as of August 1st, but thank you. But what we were really pretty surprised around is the continued increase in the number of deaths. And while addiction has been around, we all know, for a very long time, and heroin has been around for a very long time, the synthetic forms of fentanyl, and the medical examiner, Dr. Gilson, said that he's aware of 12 different types of fentanyl, and that's just the count as of last week.
20 analogs.
Yes, it is. It's alarming. So we don't feel as if we're ahead of this epidemic, while we're constantly trying to expand services, making the array of services more creative based on what we're hearing back from individuals in recovery, hearing voices from families. What have we learned? We need more of everything. We need to be open to new models that other states have tried. With the epidemic fairly in its infancy stage, if you will, in terms of the addition of the fentanyl over the past 3 years almost, we really need to take a look at what works in other areas as well. One of the things that we have learned more recently in the past year is that the stigma or the perception was that this was a wealthy family, primarily Caucasian epidemic and crisis. Well, that's far from the truth in America, and in particularly in Cuyahoga County, with the, again, varied forms in which fentanyl can be distributed within the heroin, and now in crack cocaine, and now in marijuana. We're seeing that it certainly does not discriminate in terms of this epidemic or crisis.
I'm not optimistic. I've been doing this since 2008, as you said, and being a drug court judge is like having a clinical addiction practice. I see my patients, or my defendants, once a month at least. And I've been involved in the bigger picture issue here as to why people are coming to this still. We are poorly equipped in this country to handle dependency. We were behind the curve when this public health epidemic started, and we've done very little to address how we treat dependency. The people at this table have done an excellent job, but we need major changes to our healthcare infrastructure. We need our hospitals to step up to the table and help us dig our way out of the hole that they helped create by their overprescribing practices. We need more detox centers. We need more physicians who have waivers that are enabled to provide medication-assisted treatment in the form of Suboxone and buprenorphine, scientifically shown to be the best way to help with recovery. There are only 30 doctors in Cuyahoga County who have waivers. 30. It's kind of shameful.
Chief.
Well, in Lorraine, in the last 4 or 5 years, we've just seen a really devastating impact of this epidemic, and I think law enforcement and everybody in general was pretty slow to recognize what was happening. For us, for me, in 2011, we had 22 overdose deaths, and at that time it was prescription opioids. And all of a sudden, in 2012, less than a year later, we had 60. And so, that forced us to get together, and we called in all of our, our health department and our hospitals and everybody and had a conversation. That's eventually what led to us, fighting to get Narcan in the hands of our police officers. But for us, I guess I'm as disappointed as the judge is, in the sense that I don't see the medical field, which I think played a huge role in causing this dilemma. And I don't see the public policy, I don't see the funding still moving in the direction that it needs to go to alleviate this problem. For us, it's a painful thing. I come in every day and I look at reports, and we're averaging sometimes 3, 4, 5, 6 overdoses. Not all fatalities, but and of course we've seen a large increase in everything from burglaries to breaking into cars to robberies. It's not unusual for us to get calls in the middle of the day, in the middle of the morning, at a fast food restaurant and find somebody overdosed in a car. We had a young man who came home and found both his parents in the garage, dead at the same time. And we've had people driving and cause accidents, and by the time we get to them, they've overdosed, and they have children in the back seat of the car. So it's an epidemic that touches us all, and I guess I'm just frustrated by the fact that it doesn't seem to me to be internalized by most of our citizens.
Right.
It seems like we've compartmentalized our lives, and we're able to kind of watch that on the news, but that's them, like we've done with so many other issues. And I guess I just hope that someday, everybody can understand these are human beings whose life has value, and that we all need to come together and put our resources.
Can I piggyback?
Yeah, go ahead.
The chief and his department and departments like his who use Narcan should be praised. We're lucky in Cuyahoga County. Most of our police departments have embraced it. And there comes a compassion fatigue, though, with police officers who keep Narcan in the same
Right.
people. And the reason that they have to keep Narcan in the same people is people don't understand, what happens when you get Narcan. You go into a form of withdrawal. So the dependent person gets thrown in withdrawal, and his brain is telling him to go back out and use to alleviate that dope sickness feeling. If we had an infrastructure where the Lorain police can take them to the ER, that they are anyway, where there's a medical professional on hand who could talk to them about administering them buprenorphine, that would control those withdrawal symptoms. Their brain would stop screaming for heroin, and then they could focus on whether, is this the point in time I want to get clean? We have to promote harm reduction strategies like they use with police and Narcan. But we have to build the infrastructure that the well-meaning police can hand off their overdoses to help them turn the corner towards recovery.
So let's talk a little bit about that. One of the things that I've been watching a little bit lately, the Ohio Substance Abuse Monitoring Report, the one that came out in January, there's just some chilling, very chilling quotes in there. And the one that stuck out to me among a lot of things that was pretty scary was everyone wants it cut with fentanyl because it's stronger. And it's better dope, and it's mixed with carfentanil. If somebody overdoses and dies, heroin users want to provide that dope because it was obviously good. If somebody dies off of this stuff, everybody's going to flock to it. How that user went on to say essentially that, hey, I've been revived 5-6 times because they know that Narcan's out there. How do we find ways to break this cycle? How do we find ways to stop the ever cheaper heroin, the ever more increasingly powerful heroin with fentanyl and carfentanil, and then how do we start to get the kind of interventions that you're talking about here?
I'll suggest there's a couple things at play. There's actually many things at play. I think first and foremost, we have a really warped understanding of drugs, drug use. If you talk about things being laced, right? So we've created a culture where there is such thing as recreational drugs, and even take the moral side out of it, you could do a wonderful job of painting the picture that one thing is another gateway to the next thing, to the next thing, to the next thing, and part of it's shifting our mentality back. I laugh and joke. Back in the 70s, early 80s, Nancy Reagan went around and just said, "Just say no to drugs." We all laughed and we all joked, right? But at one point, there has to be a message about that says that all this is not healthy or life-giving. And I think another piece to this puzzle is really helping people to find healthier recipes to living. Healthy, holy, and again, it's religion is a part of that, but that is a part of healthy, holy, happy lifestyle again. And then even to the medical piece, we have a zero tolerance for pain in our lives. And again, to be clear, nobody should live in debilitating suffering. That's not what we're talking about. But not all suffering is bad. So you're going to the hospitals and saying to the doctor, I want to walk out of here, although I just had major surgery, with zero pain. Well, how do you get, so to speak, fixed and have zero pain? Those are types of questions beyond just the heroin epidemic. Those are other bigger questions that people, and we as a culture really need to reflect on to help people find pathways of healthiness, holiness, happiness. And again, I always say this, I've said this for years, with the alcohol or drugs, people that work programs of sobriety and serenity, they're the healthiest and happiest and holiest people that are out there. It's the recipe to healthy living so that you don't have to necessarily make these choices. And if I could just piggyback off the judge here for a second, you're talking about this is a public health crisis. It is a public health crisis, and it's even more. And it's only going to stop once the collective will says, we've had enough of this, and we're all going to work together. That's why I really praise Cleveland Magazine for what you're doing. The energy that you're spending on is because until we get everybody to have that level of ownership, awareness, and say, we've got to address this together. It's too large just for the police or the law enforcement or the Adams Board. It's going to take all of us to do this.
Well, you also have to, to dig our way out of this, look at the ultimate question is, why do we use to begin with? And as Father said, as a nation, do we send the wrong messages culturally? I think in large part we do. Is there a mass spiritual bankruptcy out there? Possibly. What is popular society? Going to a Browns game and drinking the Mutiny lot before the game, or going out to Cuyahoga Valley National Park on a Sunday and hiking in nature and seeing the connectiveness of everything? The Browns win. Well, sometimes.
Eventually.
But,
The judge really is a man of hope, right?
So, we're in the midst of the war right now, but it boggles my mind. People keep coming to this. Young people who feel invincible, who have poorly formed frontal lobes or not fully developed frontal lobes. Everybody knows heroin kills, or should know, but still, you're a teenager, you're at a party, somebody gives you something to snort, you think, hey, one time. One time's too many. So examining the, we live in a very wealthy country, and a lot of people use the recreationally because, frankly, at the start, drugs are fun. They make you feel good, and then they own you, and then it's a nightmare. So we have to examine the origins of our use.
And to piggyback on Judge Matia's comment around the war analogy, I'm glad it's a war analogy. I can follow that. The chief gives me sports analogies, which I have trouble with. But, to piggyback on that, we do have some soldiers on the ground that I think is an untapped resource. And as we talk about the sober living environments, where the birth, if you will, of support groups, AA, NA, CA, Cuyahoga County has HA. There are individuals who have long history, long-term sobriety that can now be certified by the Department of Mental Health and Addiction Services, who are strong in their recovery. So my idea is let's plant some of those recovery coaches, if you will, in an emergency room for that person who is revived for the 9th time to be there by the bedside to say, let me talk to you about recovery. Will it work? We don't know until we try, but we talked the other day about the importance of including our hospitals in this public conversation.
Right.
And we really have to do that. So that's just, in my mind, a relatively affordable resource that's untapped.
That's a great idea. That is just a fantastic idea.
One of the things that, everyone's kind of talked about it, so let's talk. There's no one from healthcare on our panel here, but let's talk about it. One of the things that I found in the coroner's report when he testified was that 72% of all heroin-related deaths from 2012 to 2014 had been prescribed controlled substances within 2 years of their overdose death, and 50% of those were opioids. So clearly, medicine has played a role in this. And similarly, all these people had been within the healthcare system. They all had a doctor, and they all could have been diverted to other pathways to pain medication. What role has healthcare played, and how much more should healthcare be stepping up? We've kind of mentioned it, but let's talk about it.
I'll tell you a story that really turned me to be much more passionate about this. It's from one of my own members, and long story short, 7 years ago he was in a car accident. He's now in his mid-30s, or was in his mid-30s, and over-prescribed pain meds. Now, part of it's the medical profession,
right.
Part of it's he kept asking for them. Let's be fair, right? Long story short, the family spent 6 years helping him find a program and a pathway to recovery. Last Easter, thank you God, after a year of sobriety, he drove from Tennessee to come home and see his dad and sister. That ride hurt his back. He drove back home. He went and got heroin to cut the pain, and he's dead. And you talk about devastating.
Right.
And it really paints the picture of, what is appropriate, what is appropriate pain that we need to live with? What are the pressures that we're putting on our medical profession? And I think again to the question, really what is the responsible use of pain meds and what are better paths, healthier, natural paths to deal with pain? Right. And I think the medical profession, again, all the conversations that I've been involved with in this, I think they're certainly working to address it, but again, it sounds like I'm going to be repetitive for the sake of being repetitive. Until the collective will is so strong that we all say, this has got to change, they're going to continue to do what they're going to do until we say enough is enough, and we need to find a better way to manage pain and to manage through the situation.
I actually would like, on behalf of the Adams Board, to share a very positive, and I'm optimistic about growing our conversations within, I'll say, Metro Health. In particular, we have supported the funding of the Project Dawn, which helps to distribute the Narcan kits this is going into our 3rd year.
Dr. Papp's program.
Yes, Dr. Joan Papp's program. And in conversations with her as recent as 2 o'clock this afternoon, but just as an example of me sharing out loud, we need to really grow our collaborations. They have ideas around medication-assisted treatment. You know that Dr. Papp is spearheading these conversations within the hospital. As Judge Matia acknowledged the limited number of positions we have in a county that is rich in healthcare. 30 is less than 1%, I'm confident. Don't remember how many zeros behind the decimal would reflect it, but I'm encouraged, is what I'd like to convey, that we have had conversations, Metro to start, and it's my plan to have similar conversations along with our partners with our other healthcare environments.
I'd like to be a part of that.
Absolutely.
Yeah. It's clear, to answer your initial question, that we wouldn't be knee-deep in heroin deaths without the overprescribing of medication. In Ohio, from I'm a statistics guy. We're not dealing with just anecdotes here.
Right.
From 97 to 2010, the average per capita pills per Ohio went from 6 pills to 67 pills. From 97 to 2010. If you chart the overdose death rate per year, the statistical correlation between the rise in pills and the number of overdose deaths was like 0.946. It's almost a perfect one, and any mathematician could tell you, it doesn't get any closer than that. So the evidence is clear. The overprescribing of opioids brought us on this problem. The United States is 5% of the world's population. We consume 80 to 85% of the world's opioids. Our own medical profession does not follow science in regard to prescribing practices. If they did, other countries would be prescribing, other first world countries would be prescribing the same rate. Opioids are not appropriate for most non-acute pain. The scientific literature studies show that you prescribe an opioid, you have, first of all, the patient uses the healthcare system more than. You want people to use the healthcare system less. They are more likely than folks treated otherwise with things other than opiates to use other illegal drugs, i.e. heroin, and their healthcare outcomes are worse. The literature is clear that opioids are very ineffective generally in healthcare. The question is, why has the market been flooded? Why have medical professionals that we turn to, that we trust with our lives and our children's lives, why have they failed us so badly? I'm sure many of your readers with MDs are going to be unhappy with my comments. I don't care anymore. I see people die, regularly that I know, that I've had in drug court. Fortunately, we've been pretty lucky lately, but you know, we lose more people now every year to overdose than we lost in the entire Vietnam War. The statistics have made us grow numb at this point. You know, until it happens to somebody you know or remember, then you know you just can't read the stories anymore. We need to focus on, you know, what Ms. Hoover's talked about, you know, partnering with our healthcare providers, demanding that they come to the table, not asking, but really demanding at this point, that they start working with us to, we could start a Favor the Waiver campaign for primary healthcare physicians. Get them, it's an 8-hour course, then you're authorized to prescribe buprenorphine. That's not enough. We need to have the peer support specialists placed in the emergency rooms with a doc who can prescribe, if that peer support specialist can convince the overdose victim. We need to treat people outside of the criminal justice system for this. So, and we're, again, this problem of dependency in this country, even if we took away today's heroin crisis, we still have alcoholism, we still have cocaine addiction, we have always had addictions, and we don't have adequate infrastructure to treat them.
Chief, it just seemed that your job gets harder and harder because of the cycle that I kind of mentioned earlier, that the drugs just keep getting cheaper, they are more addictive. So where is law enforcement in the front lines of this, and what can law enforcement do better, or what can happen on the law enforcement side to at least, you know, slow this down? Because it just feels like, you know, you take a drug dealer off the street and 5 more, you know, fill that person's spot.
Well, yeah, I agree with the judge. First of all, that the pharmaceutical companies and the overprescribing really help create this dilemma. But you know, I was a narcotic officer, you know, back in the 70s, and heroin was a problem then. It's just more pure now, more dangerous now because of the, you know, the fentanyl and all the other things that they're mixing with it. But I think most law enforcement agencies have come to the conclusion a long time ago that we're not the answer, and that we're never going to arrest our way out of this problem. There's always been a hesitancy on our part to get involved with the social networks. You know, we thought they didn't understand us, and we certainly didn't understand them. But I think there's more openness to that now. We've done it in Lorain County. I see it everywhere. And I think that what we can do is, first of all, I think we have a bully pulpit in the sense that the media pays a lot of attention to what we do and say. And we can certainly talk about the programs that, you know, like the drug courts, the Perry program, where, you know, we have a program where they can come to the police station and say, hey, I have a problem, and we don't arrest them. We don't, even if they have something on them, we don't arrest them, you know. And there's so many other, you know, but I think what we need to be a voice for is, I can tell you the problem we have as the cop on the street, is that we run into overdose, whether it's a fatality or somebody that just has overdose. There really isn't any help in the middle of the night and on weekends. And even when they do overdose, we take them to the hospital. A lot of times they don't even have addresses. So if we can't get them into the hospital, then we have no place to take them. And we've tried to get them to come to the scene on weekends and in the evenings. That hasn't worked out very well. And sometimes you have to go to them because they're just completely, you know, their addiction has control over them. And they're not going to seek out that help until they're really ready. So I think what we can do is talk about those issues, be part of community networks, whether it's task forces or we have a project down in Lorain County also. I think we just have to look at other avenues, but the main thing we need is we need detox, a place to take them to detox, and we need a residential treatment, which doesn't exist in our county. That's a big problem for us.
I'm really encouraged by our law enforcement's response to this. The Perry type programs, police, addiction recovery initiatives, I forget the acronym. You know, police don't want to arrest another person. They want what we all want, a healthy community. So, you know, they're working to gain the trust of those who are sick and need a recovery to come in. We'll get you help. Berea has a great program. Olmsted Falls has a great program. These are, you know, moving across our area and taking hold and building, and it's really encouraging. And it's kind of a, you know, organic infrastructure build. You know, somebody gets arrested or somebody ODs, the police can take them someplace where they can get help. They don't. They have some places, as the chief said, but they don't have enough. Right.
And to your point, gentlemen, access to service, I would only imagine, as you talked about, in Cuyahoga County, while we have some 24/7 environments, primarily residential, some of our detox, we're not, for the most part, we're a system that operates in banking hours. And we have got to figure out a way to expand the services. It's frightening for me as a public servant in behavioral health that a person must wait at times, up to 4 weeks for women, up to 5 weeks for men. That's challenging for me. We're getting better, I will say, by the addition of extra treatment beds, contracts with sober housing, and other options, ambulatory detox or outpatient detox, if you will. But accessing service is probably one of the 10 tall hurdles as the incoming CEO that I'll inherit from Chief Dinahan. How do we fix this? How do we get better at it? And of course, at the core of these conversations is funding.
Well, look at her point. It's, you know, dependency is a chronic disease. So is hypertension, which means if left untreated, it will kill you. Now, if I'm having a hypertensive episode and I go to the ER, they're not going to tell me to come back in 4 weeks.
Right.
They're going to take me in right away when I'm ready to be treated, when the problem is discovered. You know, we need to treat dependency the same way we treat other chronic diseases.
I don't pretend to be an expert in this. I don't. But over the last 2 years, I've probably had thousands of hours of conversations, literally just. And there's two collaboratives that I really think I kept hearing and even talking even to the Attorney General's office about. Collaboration number one is that because of the scope of this problem, all of us need to work together, every single one of us. Collaboration number two is there are, in fact, we are very blessed across the region, not just Cuyahoga County, across the region with a lot of service providers, but there is no collaboration with them, and especially how do we learn best practices, best techniques, so that effectiveness goes up, honestly, efficiency goes up, and it would stretch the very, very limited resources that are out there. It would make those dollars even more effective. But, you know, Chief, even to the conversations about 5 months ago, I was in a conversation, there's a guy who's running a very good rehab facility and expanding in Valeria. Wonderful. And literally 3 minutes away, there's another group that's going to build one. The two of them didn't even know that each other existed. And I'm literally, one's here, one's there, and I said, and having these conversations, well, what do you two need? I'm going to go have lunch, right? But the point is, like, how do we get the service providers to figure out that, especially because of the magnitude of this, if they would get together and streamline themselves and again learn best practices, it really would make them more effective, more efficient, and take limited resources and make them go farther.
The conversation really has in the last year or two shifted from this being criminal to this being a public health crisis. And how much has that shift in conversation helped and changed the way that you do your jobs?
I think part of what I hear and what I deal with is still is a lot of the stereotypes of drug use, and that's why, again, just to give you props. I mean, the more all the media outlets can be talking about this, we need to break the silence around this. and a stigma around this so that people can talk. And the experts can tell us much better than I can that the physiological effects of this are radically different. I think the Adams Board has done a great job of defining this as a brain disease. Having said that, we need to get people to have much more compassionate hearts, as the judge even was sharing stories before, right? I mean, you'd like to think that nobody sets out to be an addict, and nobody really wants to live that life if they knew there was a better way. And so we need to break down, we need to move beyond our stereotypes. It's all that just a drug addict, because again, this is transcending every socioeconomic background. And how do we bring compassion to that person and then align the right resources? I think, again, what I keep bumping up with is, is the stereotypes. It's a drug problem. Why are we reviving? Why are we wasting our money reviving? Well, eventually that could be your grandchild.
And certainly the Adams Board public awareness campaigns has only made slight dents, we believe. While we're really doing a good job with social media, we have placards, we have kiosks, we have informational workshops. We know we need to do more to talk about it as part of the public conversation. And my definition of collaboration is twofold: working together with other systems, other concerned citizens, but also asking that other service, other system, and concerned citizens, can we put our nickels together to make a quarter so we can expand those services and needed funding? So that's my twofold definition as I look at Judge Matia. That's my twofold definition of collaboration.
The Adams Board has been a wonderful partner, as have so many others in Northern Ohio. I think the public could see what I see as far as people working together across institutional lines. They'd be very impressed. Law enforcement, the U.S. Attorney's Office, independent police, suburban and the City of Cleveland Police Departments, the Adams Board, Dr. Papp at Metro, really would make the public proud. You hear the bad stuff in the news. You hear the story about the outlier sheriff in Butler County who won't provide Narcan. But what the public really needs to understand is he's the outlier. Most other police departments embrace harm reduction techniques. You can't get a guy clean if he's dead. So you engage in harm reduction techniques. So Northern Ohio is the birthplace of AA. We're lucky we have that infrastructure there. But what we need is the medical community to partner with us. St. Vincent's is doing some interesting things that should be assisted. Trouble is, the way the laws are, and the way Medicaid reimburses, there's not a lot of financial incentive for healthcare providers to get involved in the game. And we have, I don't want to get into the IMD rule, it's complicated, but that limits how big the infrastructure can be. It is 16 beds in a facility. 16 beds doesn't do it. So would we limit the number of, again, chronic disease example, would we limit the number of diabetics we treat in a hospital to 16? That's a rule that needs to be re-examined. So things are good in Northern Ohio in terms of cooperation, collaboration, but we need a more powerful person than all of us individuals at the table, a more powerful entity to design a better system, who has the authority to design a better system, to incentivize doctors to go into addiction medicine. You know, when I spoke to Congress, I pitched the idea of, let's do a loan forgiveness program for people who go into behavioral health. You know, we're gonna need, even if we had buildings, we still need bodies. So we need to incentivize people to do this difficult but very fulfilling work.
You know, I think it's several things. I mean, I think in terms of, especially resources, you know, we've been taking a close look at ourselves as it relates to this problem, and we've tried to do things like, you know, we have the Perry program, we have a box that people can bring their, bring their
Drug drop
drug
box.
box.
Yes.
We have those
There's
things.
50 of them or so in Northeast Ohio, right?
Right,
Yeah, right.
and we're looking at a fast response team too when people do overdose, and those conversations are being had, and there's discussions about the changes of the needles, the clean needles, because once again, you don't want people dying if they don't, if they don't have to, but
Harm reduction.
and we have to kind of look at ourselves, because one of the things we were talking about is narcotics for us has now become the biggest problem in our city, in our county, and they're also responsible for a lot of the other crimes that we have.
Right.
And yet we only devote a very small percentage of our manpower to the enforcement of narcotics. And that's because we lack the funds.
Right.
A lot of our city money has been taken from the state. And that's money that we could be using locally. Our ADIS board went to the citizens and put in a ballot to create some more treatment program, but it was such a large amount that it got defeated, and I think it is going to take somebody from the national, federal level and the state level to really understand that this is a huge problem that needs huge investment, and make it available to every part of this team, whether it's the treatment, prevention. We don't even do any prevention anymore. We don't have data programs, we don't have those kinds. And I think they had an impact, truthfully, because we went through a decade or so where we didn't have, this huge problem, especially with heroin. And but we don't have those programs anymore, and there's no money for treatment, and there's no money for enforcement. And enforcement is still important because you have somebody out there who's trafficking in this. You have people who are creating and producing this synthetic fentanyl, and it's difficult to stay on top of it because they're always changing the chemical compounds. Once we pass a law, they change the chemical compounds, and it becomes complex. And so I think instead of talking about some of the things we're talking about at the federal level, they need to understand this is a national crisis and devote the energy and the resources.
The rest are important from a non-trafficking region. Unfortunately, the criminal justice system has been the de facto, treatment provider in this crisis. So until that changes, I don't get any drug court clients unless somebody gets arrested. And the hook we have in drug court that mom and dad, the parent of the heroin dependent individual doesn't have, is I have an ability to hold them accountable. That I've got a couple guys who have guns and badges and handcuffs. And if you're not going to be compliant, come go get you, and you'll sit in a holding cell, and you get a chance to re-examine how committed you are to recovery. We know that incentives work best rather than sanctions, but having that ability is a really leverageable thing that leads to people successfully recovering. So we need our friends in law enforcement to bring us customers.
And thank you. As we talk about state and federal and even local, my only caution, and this is strictly Valeria's opinion, is that at times our dollars are so earmarked and prescriptive that while it might be a generous number of zeros behind the allocation, it's targeted only for a particular use within this crisis. My voice is very loud in saying that there are gateways, as we earlier identified. In my background, we know that marijuana is a gateway.
Right.
We know that the sedatives and the list goes on. So while we're trying to combat this, or at least even if we get neck and neck with it, I'm not sure we'll ever be ahead of it. Let's make sure that our dollars are best prescribed its use based on the community in which the dollars are funneled to. Because we know that maybe a fraction of the allocation could go to support our continued CIT, crisis intervention training for police officers, where we've done a very deliberate job of integrating information around substance use disorders and the disease of addiction. So That's what I hope that they probably would never ask me to testify in front of Congress, but I would hope that the allowable use of the dollars with all the right intentions can help with the disease.
Judge, when you were talking about mom and dad with their child, one of the really difficult and painful pieces of this is mom and dad in this case are often 70 and 80 years old, because a lot of the people that are struggling with this are their adult children who are in their 30s and 40s. And so part of it is also in the spectrum of education. You know, a mom and dad know their child always like the back of their hand. We need to educate and empower moms and dads when they see their child, their adult child, 20, 30, 40 years old, not them their best selves, to really raise the questions. The other parallel to this is, if you think about public health crises, so when Zika was a problem, we literally, the world aligned its best resources to eradicate that. Thank you God, right? Or when Ebola was, same thing. You know, that's my phrase, the collective public will. That's the energy. And I had just a good perspective. For me, it was Memorial Day weekend. You know, and that was terrible, terrible. There was the terrorist attack in London. And on the news on Tuesday after Memorial Day, they were talking terrible about the 8 people that lost their lives. And the very next news story was about the 14 people that died in Cuyahoga County alone because of heroin overdose. And again, one is not right or bad, they're both terrible, and they both need to be addressed. But how do we literally put the spotlight, if you will, that energy on this, we need to deal with this. Your family is going to deal with it whether you like it or not.
The Adams Board has done wonderful things with funding of our limited but wonderful treatment friends, Cel Rivera, CATS, Community Assessment Treatment Services. Stella has a detox, but again, it's 16 beds.
Right.
So we need to, one, understand the disease, because when you understand the disease, you realize where's a point where you can do the greatest good in getting people to walk towards recovery, to want it, who are ready for it. And sometimes when they overdose and they get arrested, they're still not ready. But you just got to have the resources available for when that switch flips in the person's mind that today's the day, I don't want to do this anymore.
One of the ideas that in all the conversations and the meetings, the discussions that I've had about this, is how do you do 2 things. One, the Dalton Foundation is preparing an app actually that'll be able to be used regionally, so that so all these resource providers will load into this. It's much like hotels.com. I am 28 years old, I am a male, I am in this city, and I need help dealing with this. And it will say, here's the bed that's available. Call this number right now. So the Dalton Foundation wonderfully is working on that. The other piece, and I've had conversations and some of the discussions I've helped stir up with the Attorney General. In those moments when they're ready to act, they literally need a phone call to talk to a person who will find a way to connect with them quickly and walk them forward. In that moment, they're ready to act, and they need somebody to accompany them on that journey. But that really raises, as the Chief said, the question, this would be most effective because our first responders really are not equipped to be able to do this. How are we going to fund this so that phone call gets them somebody there that then walks them to a better place quickly?
And the Adams Board has funded a program on a very modest scale that does just that. We're trying to grow that application, if you will, whereby it can then have the awareness real time, which is the important part of this, availability of services. We don't have that component yet, but you can speak to a person, licensed clinician, 24/7 by this application on the phone. Now, I don't know what kind of phone Yes, but it's an application that we funded. The program is through Essentia, and the partner agency is one of our funded agency, New Directions. And so far, the information that we've gleaned from the utilization is very positive, extremely positive. So we know that that's another real-time way to be connected with a person. Prevention is also an area.
What about the Adams Board hotline number?
I'm sorry?
The Adams Board hotline number.
Absolutely.
We need to get that in.
Yes, we have a hotline number. The area code is 216-623-6888, and that is 24/7. We also have a strong partnership with United Way 211, who has a very elaborate list of resources throughout the county, and that's just to name a few.
Right.
So just wanted to make sure that I enjoyed the application part.
I just, once again, have to reiterate though how important it is, and I think apps are good, hotlines are good. It's a human being coming immediately and connecting to that person and being able to tie in his support network if he has one, his parents, his family, or anybody who loves him, and just convince him this is the time, and then not only have a place to take them, but also be able to provide that transportation and that immediate support. And I think without that, it's not going to work.
We've talked a little bit about the bed situation. Is there momentum? Is this legislation that has been proposed to sort of double the beds? Is there enough momentum now to get this done, or are we still going to be wrestling with this issue a year from now?
I think we're still going to be wrestling with it a year from now, only because
Without a doubt.
I know that our addicts board, and I don't know if you know Tom Stuber in Lorraine County, has been putting out emails almost every day. Please contact this congressman. Please,
Right.
Medicaid's the loss of Medicaid is going to kill us, and it's going to affect all these people who need treatment. They're not going to have the funds, and the agencies aren't going to be able to have the funds they need. And so I don't feel confident that they've embraced, or our Congress or state has embraced, the value of these human lives.
In the interim, while that, and I agree with you, Chief, that I don't believe that it's going to have a resolution, and just how archaic IMD rule is, it stands for Institute for Mental Disease. So that's the 70s, 60s, maybe even the 50s. But what I do think can help, and what we're funding and growing, are recovery housing, whereby individuals who are still some level of ambivalence in some of the homes, they certainly can be lived there while on medication-assisted treatment, as Judge Matia, and we know that medication-assisted treatment works. An abstinence-based model does not work. It's not nearly as effective as medication-assisted treatment. So in the meantime, recovery housing, which is not a part of the similar rules under Institute for Mental Disease, while we're not encouraging large structures within communities and neighborhoods necessarily, we have really grown our portfolio of recovery housing resources for individuals. And then I'd just like to close my comments by suggesting that the behavioral health world must really become a system of benevolence and tolerance. We can't ignore an individual who has their 19th bout in detox, because recovery is so individualized and so personalized that it becomes challenging. Who are we to decide that this person is not yet ready? And that's controversial, even among our providers. But I really want to be the spokesperson of tolerance and benevolence in recognition of the severity of the disease of addiction.
That's a good point. We're talking about people who need of help here, in a vacuum, somebody's kid, and you kind of portrays them as, innocent victims in a nice light. We need to recognize that these folks aren't very likable when they come to us. They have been turned by their brain disease into lying, conniving, manipulative individuals. And if we recognize that, we'll help them turn back into children and parents and employees and neighbors. I've seen the transition, and it is an amazing miracle to watch. You get somebody to come in, and they're, even knowing what I know, sometimes I don't want to take them. And then it's always the most unlikable defendant that surprises us to the greatest degree and keeps you going to work with the next most difficult person in recovery. So if we recognize, yeah, they're diseased and they're not likable, but they are worthy of saving. When you see the human potential of people, it's amazing. I went to Bill Denahan's retirement event last night, and I ran into 2 of my graduates who now are working in substantial positions in the recovery community. Nothing made my night more than that.
The other practical piece of this is, as we talk about the individual who's struggling with the addiction, we're looking at that individual in a vacuum, but they're part of a neighborhood. More importantly, they're part of a family, part of a community. And so, at the heart of this conversation is, it's not just helping the person that's dealing with the addiction. It's really the impact that it has on the whole. And that's, again, there's 100 reasons why we should all be engaged and really become much more passionate and involved in this. Certainly the respect and the value of each human life, the goodness, the potential that they have, the impact that this has on their families. These are our neighbors, these are our co-workers, these are our classmates and friends. And so this person struggling with this disease really affects a whole pool of people, not to mention the whole community. And again, that's where I'm going to come back and say, that's why all of us need to become more aware, more involved, break the stigma, break the silence, and really engage in this fight for this battle, this war that's going on. That is, if the numbers hold, and they probably will, the state of Ohio will lose 4,000 people in 2017 because of overdose, heroin overdose in particular. And think of the human toll, and again, that's part of particularly what I get to see.
Unfortunately, I think you're really low.
Wow.
Yeah.
And I was just going to say that, like the judge said, these aren't very pleasant people to deal with. And I think that when you talk about medical people and people in professional fields, they don't particularly want to come down and deal with that those individuals. And so maybe one of the answers would be, it seems like the more degrees you get, the more advanced degrees you get, the less you want to deal with people who are unpleasant, whether they're mental health patients, whether they're homeless, or whether they have substance abuse problems. And so maybe the answer would be to have paraprofessionals or people who have 1 year or 2 year degrees, that are easier to get, young people who are struggling, want to help, want to make a difference in somebody's life, but maybe don't have the ability at this point to go and get, and to create a cadre of young people who are willing to come out in the evenings, who are willing to come out in the weekends and make a difference. I think that would be a less costly way of putting some help out there immediately in the next year or 2.
I'll ask a hypothetical question, but then a very real question, and maybe we can end with this. If money were no object, what one tool do you feel like would help most in this fight? And then follow with that, the second question is, have we started to build up enough momentum on a local level to pass the kind of funding that we may not be getting from the state or the federal level to help combat this? So if money were no object, what would you do? But are we ready to commit to committing money to this on the second hand?
I would come back to the person that comes and literally sees the person struggling with the disease, that phone call, that individual person going, and I've heard story after story that would have changed the game. And so I would align the resources, that one phone call, get you that one person there. And I think there's a growing sense that this is a need, this is a crisis, this is a problem. I don't sense yet the collective will.
If money were no object, in accordance to Ohio Revised Code, the Adams Board is the safety net for the behavioral health system. If money were no object, I'd create the continuum. Am I cheating on my response? Because I'm getting a lot of different programs and services, more of, starting with prevention for school age, through community forums, to early intervention, treatment, sober housing, recovery housing, peer support. So a continuum of care. If money were no object, I would enhance it.
And do you think that we're getting close to a will to start adding funding? We weren't there in Lorain County. Have we started to get there in Cuyahoga County?
We certainly are going to move towards creating the will. I recognize we have work to do within our community through public awareness campaigns, acceptance, education. We've been combating stigma for as long as I can remember, but we're still not yet there. So I think we need time to do more around information, education, and building resources.
Tough question, and there's, it's almost unfair.
Well, that's why I ended with it.
Here's my answer. What do we pay our cardiologists to treat the heart, a diseased heart that's diseased because of, largely of choices people made in lifestyle? Why don't we pay the person who treats the mind, the diseased mind, the addiction psychiatrist or the mental health professional, in a similar fashion? If we could change that, we'd attract more people to that. We'd attract more research. If you have more of the best and brightest working on this problem, and we'd have our medical providers involved in the solution.
Chief?
I think if money was no object, it would have to be the availability of detox and treatment at all hours of the day, 24 hours, 7 days a week, supplemented by people who come directly to the where they're needed and provide that one-on-one, letting this person understand that he's valued and his life is important and that he can do this and there's people here who want to help you. I think that would be if money was no object. As far as the collective will, in Lorain County, actually they are working together. Our ADIS board has brought together. They started the Narcan program there in the state. They're working on the Perry program. They're working on the emergency response team. So they have the collective will, I think, in the county. Now the public didn't have that,
Right.
didn't support
Right.
it, because it was such a large request. But I think what probably needs to be done more is bringing that collective will together with the collective will of Medina County and Cuyahoga County and becoming a larger advocacy voice and then approaching the state and federal level.
Yeah, we don't ask our local taxpayers to fund Ebola and Zika.
Right.
Why are we
Exactly.
doing the same? We need a top-down approach from the federal government.
Exactly what I'm saying.
Well, I just want to thank you all for being here today. This was a great conversation, and hopefully it's just something that continues the conversation as we move forward.
Good. Thank you.
Thanks.
Thank you.
Thank
Yep.
you.
Okay.